We are going to go through the development of a fetus from week 13 to week 31 and a possible complication that could happen to a fetus during pregnancy. Week 13. In week 13, the fetus hands form fingerprints. The sensory organs such as eyes, ears, and nose begin to take shape and form the face. The kidneys are also beginning to form and take on their given structure at this point. The fetus is around 6.7 centimeters long. Week 15. In this week, the fetus is grown to be 9.1 centimeters long. Week 15 shows that the fetus's legs and arms are growing longer. The joints are more obvious as they are forming. In both males and females, the genitals began to form. The fetus is also now able to have hiccups. Week 17. During week 17, the ears are more developed and the fetus is developing a sense of hearing. Sweat glands are forming and the skeleton is transitioning from rubbery cartilage to hardened bone. It is now around 11 centimeters long. Week 19.
Week 19 brings the beginning of hair growing on the fetus's head. The nerve cells are growing stronger and throughout the whole body. The fetus is developing his or her sense of sight, smell, taste, and touch. It is also around 14.2 centimeters long. Week 21. In week 21, the baby is now around 27 centimeters long. The eyebrows appear on the fetus's face in week 21. The eyelids are now able to be opened, so the baby is able to blink. The teeth or teeth buds are beginning to form underneath the gums. Week 23. During week 23, major development of the lungs occur. The branches of the respiratory tree develop, such as the trachea, bronchi, and bronchioles. The fetus has grown to be 29 centimeters long.
It's okay.
Week 25 shows that the fetus's hair has developed a color and texture. The fetus also begins developing baby fat around their body. This week, the fetus is around 35 centimeters long. During week 27, the fetus is able to open and close his or her eyes. They are now able to suck their finger and they can sleep. In week 27, the baby has grown to be 36 centimeters long. A possible complication that can go wrong anytime during pregnancy is hydramnios. This condition means that there is too much amniotic fluid around the fetus. This can cause rapid growth of the uterus and discomfort for the mother. This condition may cause birth defects or preterm labor if the amniotic sac ruptures. One way to treat this, other than close monitoring, is amniocentesis. A needle is inserted into the amniotic sac and removes some of the amniotic fluid. Week 29, by this week, the baby has grown to be around 39 centimeters long. In week 29, if the fetus is a boy, then its testicles have descended. But if it's a girl, then the clitoris is prominent. Also, the fetus's head is getting bigger to make more room for the developing brain. During week 31, the fetus is now 41 centimeters long. At this point, the baby is now over 16 inches long. The fetus is able to turn their head from side to side. Also, fat is accumulating in the arms and legs of the body. The fetus is able to kick and move more within the uterus. Finally, the bone marrow is producing red blood cells.